I see a wide variety of problems with the families that I visit. Everything from sanitation issues to leaks and mold to infestations of roaches, mice, rats, and bedbugs. All of these things are made more complicated because some of our families are forced to double and triple up because of the high rents in this neighborhood. What I see today that's different from when I started is that people are a little more aware of the connection between housing and health. The only thing that hasn't changed is that tenants here still have difficulty compelling the owner to make the necessary changes that they need to make. The production of our first DVD came about because other local organizations wanted us to share our everyday experiences with mold, its health effects, and advocacy. In our community, we identified a widespread problem, consulted with experts, and did our best to disseminate sound advice. Almost 2,000 copies of our first DVD were distributed far and wide, making its way to the Red Cross after Hurricane Katrina. At the same time, I was invited to New Orleans by a certified industrial hygienist named Bill Southern to help offer safe mold remediation advice in person and through an instructional film. It was an opportunity for us to share our expertise with others who were worse off than us in another region of the country, and it felt like the most logical way of helping. This trip led to a massive collaboration of experts nationwide to co-produce a video that's been distributed to almost 4,000 homeowners and volunteer organizations in the Gulf Coast region.
My name is Sarah Muller. I'm a registered nurse, and I've been working with the Little Sisters for the past 5 years. One of the reasons that I work here at the Little Sisters is the opportunity to work with patients in a holistic approach. Rather than just treating a specific health problem within a patient, I can address the patient as a whole, within the family context and within the community setting, and to address all the interlocking systems and how they interact with each other. I have found that by visiting patients in their homes, it provides a much richer interaction than in other environments, that I can truly understand better what it's like for a patient, whether it's a child who's been hospitalized for asthma, or a family dealing with chronic disease such as diabetes, or a first-time young mother. And by being in their own environment, there's more of a level of trust where we can discuss and they can ask questions, and they can be a part of the process of health planning. Being a visiting nurse with the Little Sisters allows me to use all the services that we have at the Little Sisters. If I go into a home and they are overwhelmed with cockroaches or mice or mold, I can refer to our environmental program. Or if I visit a newborn and the mother is socially isolated and has mental health issues, I can refer her to our community life program, where she can get the skill building and socialization that's so essential not only for her, but for the development of the child. And also, I'll often go to homes when they're overwhelmed with paperwork and trying to navigate the system, and I can refer them to our advocacy office. So having all these services back at the office makes me a better visiting nurse in the home.
¿El sangre? Albuterol, ya tiene 3 meses que no le he dado. Pero ayer ella estaba respirando muy rápido, con mucha flema.
¿Cuándo recibió el albuterol la última vez?
Ayer. Hoy ya no le di. Ayer
Fue la primera vez en tiempo,
hace
¿no?
3 meses. Ajá.
Hace 3 meses. ¿Y ella no recibió albuterol?
No.
Antes.
No.
¿Y cómo está ella ahora? ¿Cómo
Ella
estás
tiene
tú?
mucho flema. Ayer se la escuchaba, tenía mucho ruido.
Sí.
Pero le di albuterol 2 veces en la tarde.
¿Y mejoró después del albuterol?
En la noche sí.
Sí. ¿Y hoy?
Hoy ya no tanto. Ayer como le di albuterol, pero ella se empezó a sangrar mucho en la noche.
¿Ya tiene la salina, las gotas de salina por su nariz?
Sí, pero no sé por qué ella sangra con la medicina. Cuando le doy eso, ella se empieza a sangrar en la nariz.
Posible es con la máquina, ¿no?
Sí, en la máquina.
Entonces, posible, sí, es delicada porque ella está respirando mucho. Y puede tratar de usar las gotas. Posible. Sí. Y ya está tomando la otra medicina también, ¿no?
Mejor
y singular cada noche.
Sí.